Good afternoon, Mount Vernon. Good afternoon, community. This is Mayor Sean Patterson Howard, and we're coming to you tonight with an update on the coronavirus here in the city of Mount Vernon. As we are well aware, Governor Cuomo has issued updated emergency state of emergencies for New York State, which is limiting businesses that are operating in the community. Let me just say what's going on right now. We have to understand the gravity of the situation. It's Saturday, and as I was outside on 4th Avenue today, I saw a lot of people moving around just casually, not practicing social distancing, not wearing any personal protective equipment. But we have to understand that we are living in a new time and a new era right now, and we must take this seriously. As of right now, we have over 1,400 cases, confirmed cases of coronavirus here in the county of Westchester. In Mount Vernon, we have over 25 cases that are confirmed, but we know that that number is double what we're seeing right now because there's a lag in testing. And what I need to make very important to people is we don't need to focus on how many people are confirmed positive. We need to realize the number of people who are positive, who have not been tested, and who are walking around and who have the ability to infect others. And so we need people to use universal health precautions and act as if anyone that they're around has the ability to infect them. As you can see, we are practicing social distancing. Usually if we do a press conference, you would have people next to me, beside me, but we have them about 6 feet off right now to make sure that we're keeping ourselves safe. Here in the city of Mount Vernon, we have put together an incident command team to help us to respond to coronavirus, and our Chief Odindo will speak to that in a few minutes. But we do not have them all in one place because we understand if one of us becomes infected, that we have the potential to infect those around us. And so we are operating distantly and remotely to ensure that as the leaders of the city and the ones who have to respond to this crisis in our community, that we are keeping ourselves safe. And we need people to take that same attitude, whether you're at home, whether you're still working on essential jobs. We need you to practice social distancing and hygiene measures. So as of tonight at 8 p.m., Saturday, March 21st, all beauty salons, barber salons, nail shops, tattoo parlors, and personal care businesses will be closed not only in the city of Mount Vernon and the county of Westchester, but throughout the state by order of our Governor Andrew Cuomo. We are also understanding, and it's very clear, that as of tomorrow, any business that is not an essential business should be closed. City Hall is closed to business except for our essential departments like DPW, fire, police department, water, and our building department to deal with emergencies and with continued code enforcement. Everyone else is working remotely and accessing computers and phones from home. So if there's not an emergency situation, please just let things kind of wait and turn over. You can send emails. We will respond to emails during regular business hours. And if you have an emergency, you can call 665-2300, 914-665-2300, and we will have someone who will address the phones. I come to you to report also the first death that we've experienced to COVID-19 here in the city of Mount Vernon. I've spoken with the family. I've extended our condolences and our support on behalf of the city of Mount Vernon. This is a very tough time for them. It's even more difficult in this time because it's difficult to have services and ceremonies when there is no ability to gather socially, and we're dealing with something that is very infectious. So we're asking that as you hear of deaths in the community, that you understand that they cannot bury their family members and attend services as usual. There's new protocols in place, and that just adds to the burden and the grief that the family has to deal with. So we, as the city of Mount Vernon, are looking for creative ways to support them as they are isolated while they are awaiting testing, and we just ask for your prayers. The city of Mount Vernon knows that over the past 6 months, we've been working very hard to work with Montefiore Mount Vernon and have been requesting the assistance of our governor in keeping Mount Vernon Montefiore Hospital open. This fight has continued. We are working very closely with our Congressman Elliot Engel and with our New York State representatives, Senator Jamal Bailey, Senator Alessandra Biaggi, Assemblyman J. Gary Predlow, also working very closely with our county legislator Lyndon Williams and our city council here in the city of Mount Vernon. We have kept up vigilance in this fight. We have not shrank back over the past 6 months as we've transitioned into government here, and we've even continued to ramp up our fight to keep our hospital open in the midst of this COVID-19 pandemic. We have written letters. Letters have been sent continuously to the governor's office and to the New York State Department of Health, explaining the importance of Montefiore Mount Vernon here in the city of Mount Vernon, but also its regional importance. I am proud to announce that today I did take a tour of Mount Vernon Montefiore Hospital, and their 6th floor is coming back online. The 6th floor of Mount Vernon Montefiore is coming back online. That's 40 hospital beds that will be coming back online. The 5th floor, which is their ICU, will come back online, not just for COVID, but for regular ICU needs. They have different quarantine and isolation units, which will come back online. We've also been working with our Westchester County Emergency Management System and our Army National Guard, and today they set up a tent in the parking lot of Mount Vernon Montefiore Hospital, and this tent will be heated. It has full electricity, and it will serve as a staging area for screening people as they're coming in for services into the emergency room. It'll serve as an initial screening area, and it will serve as a triage room. So if you drive by the parking lot and you see a tent out there, that's what that tent is for. It is to help us expand our response to COVID-19 here in the city of Mount Vernon. We are waiting to hear whether Montefiore Mount Vernon will become an official testing site, but we continue our work. But we do know that right now plans to close Montefiore. We're working to halt those completely and bring those beds fully back online, bring a full complement of medical services back to the city of Mount Vernon, and those efforts continue. They continue on a daily basis. We are working with our faith-based community. We are working with our New York State Nurses Association, 1199, our unions here in Mount Vernon, and neighborhood associations to continue this fight. We don't just want a full-service hospital in Mount Vernon. We want a full-service hospital with comprehensive quality medical care that our community deserves. We understand that we are an underserved community, and especially in a time of an international pandemic, we cannot afford to be underserved and not have a full complement of medical services. So that's where we are when it comes to Montefiore Hospital. Let me just see. Some of the actions that we've taken here in the city of Mount Vernon during this crisis is that we have suspended alternate side of the street parking. We've closed City Hall to the public while essential services still remain. And as I said, we have staff that are able to work remotely. We have requested help from our other elected officials throughout the state to be able to secure very important and critical personal protective equipment for our first responders and our police department and our fire department and our DPW department, because they're out there and they are responding to crises and putting themselves right in the face of COVID-19 and potential exposure. So we want to make sure that they are properly protected. We will follow Governor Cuomo's initiative and will implement a 90-day moratorium on evictions for residential and commercial tenants. So we are following what Governor Cuomo is doing in the state, and we will be issuing a moratorium on evictions of commercial and residential residents. Now, if you do have the ability to pay your rent, and if you are still working, please keep up with your bills. But if you are not, then this is a service and an opportunity that is available to you. But, you know, if you are working, we want to make sure that you keep up with your bills and you don't take advantage of something that you don't necessarily need Your taxes and your water bill can be paid online. Here at the City of Mount Vernon, you can pay both of your taxes and your water bill online. Federal tax deadlines have been extended from April 15th to July, and so there is an extension on that. Some of the other critical needs that we have been addressing here in the City of Mount Vernon is we know that our seniors and some of our most vulnerable families have always dealt with food insecurity, and in the midst of this crisis, they're dealing with that even more. And so in the past week, we have delivered over 150,000 pounds of food to vulnerable families and our senior population. On Friday, we had an emergency pantry distribution where we gave out more than 500 packages of food to different families. Here in our parking lot, working with our Feeding Westchester, those efforts will continue. On Wednesday and Thursday, we gave out over 1,000 boxes of food to seniors and 2,000 boxes of food to families throughout Mount Vernon. We also gave out over 3,000 breakfast packages to families in need throughout Mount Vernon. We are working with local businesses to ensure that we have the availability and the ability to take in donations to help address these critical needs. So if you are hungry, if you legitimately have a need, please reach out to our Recreation Department at 914-665-2420. Reach out at 914-665-2420. This morning, I had a conference call with all of our federal, our state, our county, and our city officials, where we talked about our response to COVID-19 here in Mount Vernon, the needs that we have for equipment, the needs that we are seeing in our community, and we are working together hand in hand to make sure that we are addressing the needs of the communities. Testing is free for all New Yorkers, eligible New Yorkers, as ordered by a healthcare provider. If you are interested in being tested and you're displaying symptoms, please reach out to the Westchester County Department of Health at 914-813-5000. If you are interested in being tested and you have symptoms, please call 914-813-5000. We are also planning to have an extensive conversation this week with the CEO of Montefiore Hospital, again, to continue the discussion around keeping our hospital open. Some of the issues that we are facing here in the city of Mount Vernon right now, especially around COVID-19, is because of people's fears. They are relying on rumors versus facts. So there are legitimate ways that you can get information around what's happening not only in the city, but in the state. Please check any of your local TV stations. Every day at 11 o'clock, Governor Cuomo has been giving updates on COVID-19 and executive orders and different rules and regulations that he's changing as this pandemic evolves and impacts us locally. So we're asking that you take out the time to look at your local news station at 11 o'clock each day to find out updates. The governor has a much larger platform than we do here, have here at the City of Mount Vernon, and he is able to get the message out. We just give additional information out for some residents who might have missed it, but please know that we are working lockstep with the state of New York and that we are following the different initiatives that are being handed down by our governor. Other legitimate updates on my Facebook page, on the City of Mount Vernon Facebook page, and other social media pages. Also on the city's website at www.cmvny.com. You can also look to News 12 and other television stations for updates on what's happening with coronavirus here in the City of Mount Vernon. We're also sending out email blasts. Now, because churches are closed, because other opportunities to assemble large groups are closed, it very much limits our information, our ability to get critical information out to the community. So we're asking, please watch your local news. Please take out the time to look on our social media platforms. Please go on our website. And if you know people who don't have access to email, who do not have access to social media, who do not have access to a television, then please update them on what's happening. We don't have the ability to go around and knock door to door and let people know what's happening. So we need you to partner with us in getting information out to your friends and family so that they can be informed. And then just lastly, again, we're asking that people practice social distancing, keeping 6 feet apart if you're inside and at least 3 to 4 feet apart when you're outside. We know that we've been asked to wear masks, but we know that masks are in short supply and it's very difficult for people to get them. Continue to practice safe hygiene. Wash your hands with warm soap and water for at least 20 seconds. If that's not available to you and you're outside, then use hand sanitizers. Using gloves and touching everything and then touching your face and touching other people makes gloves ineffective. And so if you're just going to use gloves and you're not going to change them often, then that's just a false sense of security. The governor has also put out an order called Matilda's Law, and that focuses on our seniors. The governor and your local elected officials are asking for all seniors to please stay at home. We know that our seniors are much more vulnerable to this virus taking a different turn than younger people who have healthy immune systems. And so we're asking that we protect our seniors. And if you're a person who's living with a senior, we ask that you're specifically careful because whatever you pick up when you're outside in the community, you can bring back home to that senior, causing them to be vulnerable. As of Sunday, March 22nd at 8 p.m., all non-essential businesses will be closed. All non-essential businesses throughout the state of New York will be closed. Non-essential gatherings of individuals of any size for any reason, parties, celebration, other social events, church, are canceled and postponed at this time. Any concentration of individuals outside of their home must be limited to workers providing essential services, and social distancing should be practiced. Businesses and entities that provide other essential services must implement rules that help facilitate social distancing. And the type of essential businesses that will be open will be supermarkets, gas stations, banks, pharmacies, hospitals, healthcare centers, utilities, and of course, police, fire, EMS, and businesses that are manufacturing health-related equipment to help in battling COVID. So please, if you need more information, you can look to the governor's website where they will have more detailed information. But we are asking people to really take this seriously. Stay at home when you do not have to be outside. Practice social distancing. Use good hygiene. And if you feel like you have symptoms, then please contact the Westchester County Department of Health at 914-813-5000 to schedule testing. Testing is just not widely available for anyone who wants to get a test. Testing is still in short supply, so we're asking that you only use this resource if you are symptomatic. Thank you very much. With that, I'm going to call on our Chief Odendo, who's going to explain to you a little bit more about our incident command system and what we're doing to respond to COVID here in the city of Mount Vernon. Chief?
Good afternoon. Thank you for the opportunity. Thank you, Madam Mayor. We're just going to update you from the operational standpoint of this event and this crisis and give you some continuing event status updates as we'd like to have you aware. Yes.
Please say and spell your title and name.
Sure. I'm Kim Robert Odendo, and I'm the Chief of Operations for Mount Vernon Fire Department, Mount Vernon, New York.
How do you spell that?
O-D-I-N-D-O.
O-D-I-N-D-O.
N-D-O.
N-D-O.
Yes, ma'am.
And first name is Ken. K-E-M?
Kim, K-I-M.
Kim,
Yes, sir.
okay. And title is chief?
Chief of Operations, Mount Vernon
Mount Vernon Fire Department?
Fire Department, yes,
All right,
ma'am.
thank you.
No problem. So as the mayor alluded to, we are currently operating out of an incident command framework, an ICS framework, which is going to allow us to manage an incident, a crisis of this stature. If you're able to see, we've set up that framework and we're conducting all of our operations based on this all hazards approach to this response. And what we're looking to do is essentially assist us in managing the span of control for this incident, given the breadth and the footprint and also the time frame that this event may take. It is going to be really important that all services, all departments are coordinated to a unified approach. In terms of the incident command structure, some of the things that we look to hopefully manage effectively would be the flow of information. And so we established a public information officer and a public information division that will manage a lot of the information. One of the issues with an event of this status or this stature is the fact that there is a lot of misinformation, disinformation. So making sure that we have a coordinated voice, at least from the city and from the individual departments that are part of this response. Additionally, we've aligned a medical officer or medical health officer, and which will allow us to coordinate our responses with the hospital. This is essentially a public health crisis, and because of that, it's going to be very important that we have up-to-date information from the hospital and, again, have a coordinated approach with Monty Mount Vernon, as well as the EMS providers that are servicing our city. We've also established a liaison, first for the mayor's department or the mayor's office, but also to reach out to the different entities, specifically the county, the state, and even the federal government when it comes to coordinating information and as well as also directing many of the issues that are going to have to be maintained with this incident. And then we've subdivided these categories to include an operations, a logistics, planning, and also financial component. As we understand with these types of events, it's very important that, again, coordination be at the forefront, being able to prioritize and sort of develop a hierarchy of needs. And to do that, we, again, have subdivided these areas. So our finance section will deal with the tracking, resources. A big part of any sort of incident like this is the ability to detail and document procurement and other financial issues, and then being able to, after this event is completed, being able to detail that information in the event that aid, federal, state, or other becomes available to the city. Our operations section will be handled by police, fire, EMS, and also DPW staff. These will be our tactical people, our boots on the ground, for lack of a better term, and essentially these are the people that are going to be going day-to-day, essential staff, dealing with the incidents as they continue to come in. Just because of the fact that we have this crisis doesn't stop the fact that we still will have fires and car accidents and issues that are going to also tax the resources, the emergency resources that are available to our city. Our logistics sections will take care of moving equipment, moving resources as needed to the incident sites, or at least being able to monitor the use of critical resources as they become available to the city. And we have different sub-departments that will handle that. And then lastly, and probably most importantly, is the planning section. And it's really important, as we understand, again, the time frame of an event like this, that we understand that it's going to be vital that we're able to plan ahead and forecast and sort of anticipate. And this, tied in with the information and being able to monitor and get good quality information, will essentially build out what our incident action plan will look like. We will be operating in operational periods of possibly 12 hours, possibly more extended if this crisis continues to evolve. But with that, being able to monitor information and plan and anticipate potential issues and be proactive in managing them ahead of them managing us, for lack of a better term. As the mayor also alluded to, due to the new normal that has become part of this crisis, our ability to activate an EOC or an Emergency Operations Center has been pretty much limited. So we have taken a proactive approach of establishing a virtual EOC. So all of our necessary department heads and or operations section chiefs are in communication, constant communication virtually through different social media platforms that we've been able to establish. And that's how we probably will monitor and coordinate many of the responses with this incident until we have the ability to meet physically in a room or space. Internally within the fire department, we are looking, and we have been for the last couple of weeks, modified our responses due to the fact the safety impact that this is having on our department, our ability to continue to respond specifically to emergency medical issues is going to be, and is beginning to tax our resources. One of the most important things that we have to, or one of the priorities definitely within the fire department, is the fact that we want to keep our responders safe. So we're managing the ability to respond effectively, again, specifically for medical issues. With that, with the equipment issues that we're having, being able to make sure that our responders have the proper equipment, with the fact that we also want to make sure that we have responders available to respond and that they're not home either quarantining or ill due to possible infection. So we are constantly monitoring that. And due to that, we've updated and continue to update our policies, our protocols. We recently, within the last couple of days, have upgraded the equipment that has become available to our responders. We are thankful to the state for providing us with additional face masks. We're thankful to EOC, Westchester County Emergency Operations Center, Commissioner John Cullen, with his assistance with equipment. And again, with that, we're monitoring and modifying our responses because, again, our first responders are our number one priority. We are, as a department, continuing to monitor potential clusters that are beginning to take or beginning to make themselves known within the city. We are, again, vigilant or attempting to be vigilant with that identification. And we're also asking that these facilities also be forthcoming with information. If there are issues with your facility, help us help you by making this information available to us so that we can respond properly and appropriately. One of the bigger issues, and this is something that we discussed since the beginning of this incident, is the fact that as much as we're managing the risks of these issues in this incident, we're also managing tremendous fear and anxiety. And so we want to make sure that A, we are mindful of that and that we're giving good information and that we're also being clear and transparent with our capabilities and then also our limitations. One other point to consider with this is as we continue to go down this track of social isolation, we want to think very hard about the mental health impact that could be the fallout of this ongoing, depending on how long this incident actually draws out. So although it is not probably prudent to check in physically with people, we do not want to lose the fact or lose the point that we do want to make sure that we are checking in on people. If we have to do it virtually or socially or through social media, we want to make sure that we're understanding and addressing the mental health aspect that could become part of these incidents. And then lastly, just to make sure that, again, because Mount Vernon has a tremendous senior population, making sure that we are able to continue to service them. We also understand that they are a high priority, and due to their possible compromised health, we want to be sensitive to their needs and consider them whenever we are responding. So we just want to keep that at the forefront of our messaging as well. With that, thank you. Yes, I'm sorry.
Madam Mayor, please indulge me just one question very quickly while the chief is here. Have any Mount Vernon firefighters tested positive for coronavirus?
At this time, we have two. We have two members of our fire department that have tested positive. We got that information within the last couple of hours. They are both, at this time, doing well, and we're doing everything we can to assist them in returning back to work. They are both home with their families and are recovering. And then we have a few other firefighters that we are also monitoring as well. But again, this is in large part due to our inability to, our ability or our necessity to respond to EMS calls, and the fact that at times we just may not understand the full breadth of the response that we're responding to.
Thank you.
Yes, ma'am.
Thank you, Chief Odindo. So now we're going to bring up our Lieutenant Charlotte Neal Young, who is overseeing our response through the police department and is working as part of the incident command system. We're breaking down silos here in Mount Vernon, and we're making sure that we've put together a strong team to fully respond to the breadth of this incident here in the city of Mount Vernon. So Lieutenant Neal Young.
Good afternoon. I'm Lieutenant Charlotte Neal Young. I would like to update you on the Mount Vernon Police Department response. We have modified our response by taking phone reports by phone. The number is 914-665-2547. Any lost or stolen property, we will be able to take that up by phone. We've also have people available to take requests for accidents report, vehicle release report, and evidence report. We're continuing our training in keeping the first responders safe. I've submitted requests for additional personal protective equipment from the Westchester County Department of Emergency Service.
So as you've heard, our first responders are doing everything that they can to continue to respond to emergency situations here in Mount Vernon, whether it is addressing emergency medical care or other issues through the police department around public safety. But it is critical, and please hear me when I say this, it is critical that if you know that there is someone in your home or in your business who has tested positive for COVID-19, or that someone is under quarantine who is in your home or in your business or in your facility, that when you make a 911 call and you ask for police or fire to respond, that you are forthcoming with that information. Your lack of forthcoming, your lack of honesty and being forthcoming with that information puts our first responders at risk. And we cannot afford to lose our first responders. We are not here to judge you if you're positive or if you're quarantined. We just have to know that we are potentially exposing our first responders to a home or a business where someone is tested positive or is on quarantine, so that they know how to properly enter the home and provide those services. We do not want to continue to lose first responders and have them be out on quarantine or have them be sick, because then that will begin to impact our ability to respond to fires and respond to public safety concerns. So again, here in the city of Mount Vernon and throughout the state of New York, as of 8 p.m. tomorrow, the governor is asking us to stay in the house, socialize with our families, reduce going out to any type of social events. Do not invite a lot of friends over to your home. All social events, church events, and things of that nature, public events, are canceled because they go against the governor's emergency requirements here in the state of emergency here in the state of New York. All beauty parlors, barber salons, all non-essential services are closed as of this evening for personal care, and tomorrow at 8 p.m. for other businesses. And essential services such as supermarkets, bodegas, corner stores, pharmacies, health and hospital organizations, home health agencies, child care, and essential manufacturing, utilities, police, fire, DPW, those things are still in effect. We are still picking up garbage here in Mount Vernon. Alternate side of the street parking is suspended, but meters are still in effect. We are asking people to take this seriously. We do not want you to fear, and we do not want you to panic, but we want to make sure that our residents are taking this incident serious. We want to keep our numbers low, and it's, again, not about the number of people that we are confirming that are positive. It is the numbers of people that we do not know that are infected that puts the community most at risk. We cannot share people's personal information. We've had people ask us, well, who's positive? Where do we live? Where do they live? So we know how to move and operate around them, or if we should be tested. If you are experiencing symptoms, again, that is what should prompt you to be tested. If you're not experiencing symptoms, they're not going to test you. And just treat everyone like they're positive and make sure that you practice social distancing. And we're going to get through this. This is not a death sentence. It's not a plague. It is something that is terribly inconvenient and very frustrating as it changes the way that we operate and we move in our communities. But if we're just focused and we follow the rules that have been suggested, we work together and we check on each other, we will get through this. Enjoy some of this time that you have to spend with your family. Play games, watch television, do some tutoring with the kids, sleep, clean your house, do spring cleaning early, and let's work on following the rules together so that we can get through this together and so that we can move forward together. Thank you so much, everyone, and have a good evening. Yes, I have a question.
Yes, Madam Mayor, a question that I was asked to ask you
Yes.
based on some calls we received.
Okay.
Are there any positive cases diagnosed, confirmed, at the Westchester Center for Rehabilitation and Nursing in Mount Vernon?
Yes, so the Westchester Center for Rehabilitation and Nursing, we have identified a cluster there, and so there are multiple cases there. We are also investigating a cluster at the Sunrise Nursing and Rehabilitation Center. And so as we are working with our first responders, our response to those places are a little bit different. We still do go in, but we just also know that they need to put on additional personal protective equipment. So we have identified a cluster at the Westchester Rehabilitation Center. That's been a little bit of public knowledge, and we are investigating a potential cluster at Sunrise as well.
Thank you.
Any more questions? Okay, thank you so much, everyone, and have a great evening.
Thank you.